Welcome to Prescription Health, a Tabula Rasa healthcare podcast. Prescription Health addresses the evolution of healthcare by focusing on news, developments, and predicted growth in value-based care models, including PACE. Join us every month for insightful conversations with subject matter experts by subscribing or visiting us at tabularasahealthcare.com/podcasts.
Hello and welcome to Prescription Health. My name is Frank Sparacino. I am the Senior Vice President of Investor Relations and Corporate Development at Tabula Rasa Healthcare and serving as a moderator today for our first episode. I am happy to introduce our guests today, Brian Adams and April Gill from Tabula Rasa Healthcare. Brian Adams is the President and CEO. April Gill is the Chief Commercial Officer. April and Brian, welcome.
Thanks, Frank. It's great to be here.
Thank you, Frank.
Brian, why don't you tell us a little bit about yourself, and then I'll turn it over to April to do the same.
Thanks, Frank. It's great to be here. As Frank mentioned, I'm President and CEO of Tabula Rasa. I've been with the company for going on 12 years and have been involved in healthcare and specifically medication management and pharmacy for the majority of my career. Very happy to be able to be here today and participate in this podcast. April's got a much more interesting background than I do, so I'm going to turn it over to her to give us some of that.
Thank you, Brian. Thanks, Frank. So I'm April Gill. I joined Tabula Rasa about 6 months ago, just shy of, and have been in the healthcare technology and healthcare services space for over 2 decades. I have had the privilege and sort of unique opportunity to work with all of the stakeholders in healthcare. So health plans, health systems, employer groups, pharmacy, PBM. And my passion and focus has really been population health and really using data and analytics and technology in order to advance healthcare for all the constituents and in an effort to help really support clinicians as they deliver care as well. And I have a great passion for the underserved. So a lot of what we do here and a lot of what I've done, certainly in the last decade, but in a majority of my career has been focused on that as well. So thank you for having me.
Great. Thank you, Brian. Thank you, April. We're excited to have you as our first guest on our new podcast. As you know, healthcare is in a continuous state of evolution. That is one of the reasons we decided to expand our podcast and create something that chronicled the healthcare journey and other value-based care models, including PACE. Today, we will be covering some relevant topics with Brian and April, including trends driving the future of healthcare, the expanding role of pharmacy in value-based care, and how Tabula Rasa Healthcare is positioned to enable the healthcare industry. Let's get started. April and Brian, with healthcare rapidly changing and an industry-wide focus on transitioning to value-based care, what emerging trends do you think are driving the future of healthcare?
April, why don't you go first?
Okay, sure. So, certainly during COVID, we saw this significant acceleration of the use of virtual care and even some forays into virtual primary care. But the key to really providing high quality care with the best possible outcomes in a value-based care model is really bringing those together, right? So bringing virtual in-office and at-home care together, utilizing data and technology so that we can really understand individual needs and risks and better deploy or perhaps extend the reach of clinicians so we can address what's become a pretty significant clinician shortage, right? So we really have two things that are at play in the system. One, on the one hand, we have this significant advancement in technology capabilities. And then on the other hand, we have a significant clinician shortage. And there are a number of ways to leverage one against the other. But I think the key is really coordination so that the patient is at the center. We're taking a consumer-centric approach that meets people where they are. So for those people that are technologically savvy and are in, health scenarios that virtual care is best designed to support, they can leverage that site of care versus going into a physician's office versus, having in-home care, which is pretty common the older you get. And so that kind of coordination effort, I think, is going to be critical as we continue down the path. The other thing that I think is pretty significant is continuing to think about how we leverage other types of clinical capabilities to solve for that gap. So Here at Tabula Rasa, we've talked a lot about how the pharmacist plays a role. And I think that's going to become more and more important because this isn't going away. It's going to be a decades-long problem. There just aren't enough people coming out of medical school and training in order to support the number of patients we have. And as the population continues to age, we're going to continue to struggle. We also have the dynamic of health inequity specific to individuals who are experiencing certain challenges around social determinants. And so really understanding who has a specific concern and being able to address that in order to ensure that the barriers can be overcome and they get the care that they need has become front and center in the healthcare space. And if we think about those that we serve today and those that are in government programs, whether they are seniors or lower income adults and children, they are significantly higher risk for things like food insecurity, transportation insecurity, et cetera. And so having the ability to understand that and provide services, supplementary benefits that will address those needs will be critical for us as well in order to continue to manage trend.
So I've got a few observations that I would bring forward. And I think everything that April was just describing, those are great examples of things that we either need to address or, are things that are trending right now that will help us to address some of those issues. A couple things that I'd comment on, building on what you said, April, was, how do we better use data to support a value-based care? We're even in a fee-for-service environment. This isn't just about just more care in general, but how do we use data and technology to ultimately optimize care for individuals? I was chatting with somebody the other day, and they were describing to me how they were using sensors that they were putting on walkers and canes for people that were in their homes. And it was really interesting because, while we'd all love to be in a position where we're preventing a fall, that's not always the case, right? And so it's important that we know when there is an event that has happened so that we can be responsive and try and get in front of somebody ending up in the hospital if there's a lower cost setting of care that can still deliver what that patient needs at that time. But if we don't know it even happened, then we've got a gap that can be extremely costly for our system, but also a really bad outcome for the patient themselves. So I think about all of these very interesting ways that we can collect data and serve that up to a clinician or to a provider so that they can do something with it as close to near time as possible. That takes a lot of work though, right? To ultimately be able to weave that into a workflow or somebody's daily activities so that it is real time, but also isn't overloading that provider or that clinician with excess data. It's very streamlined. And so there are lots of companies that are out there experimenting with this today. The one I was just describing is just an interesting anecdote from a conversation that I was having recently. But I think we need to embrace different types of technology to bridge the care gap that we have today. Another point, April, that you made was around kind of access to care. And today, especially in rural environments where we do have provider shortages, there needs to be more use of whether it's telehealth or some sort of remote healthcare. We need to find avenues to bring the care to where the patient is, where the person is. And we've still got a long way to go there. I think that as you were describing, the pandemic and COVID really enhanced our how we embrace that as a culture. And I think that we were very accustomed to going to a physician's office. And now all of a sudden we were forced to have a telehealth visit. I think that the more we can embrace those types of interactions with caregivers and providers, it's really going to help to put us in a much better position as we think about how do we integrate care going forward to support whether it's value-based care or something like that.
Those are great insights. Thank you.
I thought so.
Shifting gears a bit. And April and Brian, you both touched on this a little bit, but hoping you can expand a little bit further. There's a growing opportunity in value-based care and how the role of a pharmacist and pharmacy solutions are expanding and unlocking value throughout the care continuum. What do you think is driving this opportunity, and how do you predict this trend will evolve over the next several years?
I'm going to let April go again.
Yeah, there's a number of things I think that are affecting this trend. If you think about the number of retail pharmacies that are easily accessible, I think the statistic I heard was that the majority of people in the United States are 15 miles or less from the nearest CVS. So, your pharmacy is accessible. And I think that that's a big driver of why the pharmacist could potentially be at the center of how people get certainly what I would consider urgent care, not your broken bone, but I have a sore throat or I have a rash, those kinds of things. And as a peer, with a physician really providing oversight, I think that's one way to address the shortage, which is the other big driver. I think the other thing that I've seen in the market is that organizations are very focused on quality outcomes. And as that has continued to evolve, particularly in the Medicare Advantage space and certainly HEDIS measures for Medicaid, more and more pharmacy organizations, whether they're retail or PBMs, but really pharmacist supported, are conducting other types of or providing other types of support for patients, like understanding whether they may have a gap in care. So have they had their flu shot? Have they had their annual exam? And while some of that can't be provided there on site, it can certainly be facilitated by providing that information either back to their primary care health system or to their health plan. And that's actually been underway for several years now. And I only see that growing over time.
Yeah, Frank, there's a lot of evidence out there right now that pharmacists can have a significant impact on health outcomes and ultimately reduce cost and improve the patient or member experience. As April was describing too, I mean, they can help to narrow this access to care issue that we have right now. One of the things that we've observed is that there's a lot more activity at the state level in terms of embracing pharmacists as providers. And so we saw over the past couple of years where pharmacists are being involved in point of care testing and vaccines, doing a lot more than just dispensing medications, right? And I think that there are avenues for these pharmacists to be part of the integrated care model, and they can help with chronic disease management and other activities that today are being pushed to a physician. And one of the unfortunate places that we find ourselves in is that Medicare does not recognize pharmacists as providers. And so there is a barrier that currently exists related to reimbursement for some of these activities. And so while we have this opportunity, like April said, these pharmacists are perhaps the most frequently visited medical professional that these patients are interfacing with, because you're going to the pharmacy pretty frequently, and they can be a great access point, and they're so knowledgeable and can take on a number of these activities, yet there isn't, in all cases, a reimbursement mechanism. And so that's a real shame, and something that we as a country need to overcome to ultimately be able to close some of these gaps, because these are people that can have a really significant impact on care today. They are already, but we do need to recognize that.
Yeah, I totally agree. I actually think that, one of the things that is probably a missed opportunity, I think some pharmacies maybe are taking advantage of this, but as people are coming in and visiting with their pharmacist, it's not a particularly long interaction, but it is an opportunity. I talked a little bit about gaps. It's also an opportunity to identify where there might be support available. So if you think about a pharmacist as a navigator, if you will, so when they know that an individual maybe has access to other types of support services like food, as an example, if that's part of their Medicare Advantage benefit, the pharmacist can actually help support ensuring that someone who is recently discharged from the hospital gets the right type of food to support their recovery so that they don't end up back in the hospital. And so, again, I think that there's so much opportunity that we're not yet capitalizing on. So, agree.
I'm glad both of you talked about that. What's interesting is that pharmacists do so much more than dispense medications, but not many people outside of the healthcare industry really know that and know all of the clinical services that can be provided or delivered by a pharmacist. When we go to the pharmacy, we are often asked, do you have any questions for your pharmacist? And most people think that you should just ask your primary care doc questions and not their pharmacist. How can we build greater awareness? How can pharmacists make a difference in a patient's medication regimen and overall health? How do we better utilize pharmacists?
Can I answer this one first?
Jump in.
I don't know if you were about to turn this over to me, but I'm very excited to answer.
Yeah, go right ahead.
When I think about this, right, I've spent a fair amount of time thinking about medication adherence and building programs that are designed to keep people adherent to their medication regimen. And the thing that I think people haven't really realized is that being adherent to a medication regimen is only good if you're on the right regimen. And it's really the pharmacist that I think can help understand whether that is a true statement or not. They're sort of a central point. They can get information when they're working with a patient about all the medications they might be on, whether they're prescribed or not. And then they have an opportunity to assess, is this really the right set of things? And is there any potential for contraindication or adverse drug event, et cetera, and really keep people safe. And I think that's one of the things we overlook because we are so focused on that 80% PDC, which simply means I have enough medication. It doesn't mean I'm taking it or I should be taking it.
Yeah, the thing I would build on, I think those are great points, is the tools that a pharmacist has today to really do that review, right? And they're arguably, in our point of view here at Tabula Rasa, pretty inadequate at most of your pharmacies today. So the information that a pharmacist has to understand what those potential interactions are, or what an appropriate therapy might be, so that they can have that educated dialogue with a patient that's standing in front of them. Often they don't have the time. The fact is that there's very few pharmacies today that are even open 24/7 anymore. There's a shortage of pharmacists and technicians, so they're rushing to get scripts filled. But even on top of that, as they're doing that regular review of, is this appropriate therapy for this patient? The tools are just inadequate. They're especially for a lot of the seniors and complex patients that we're serving here at Tabula Rasa, it's almost impossible for a pharmacist to very quickly review whether or not the 12 drugs that somebody is on are all appropriate and what we should do to change that therapy, so that when we are having the conversation around adherence, we feel very confident that we're advising them to be adherent to this medication regimen that's been reviewed by, somebody that has the right access to tools. And, we've been, I think, in a unique position here at our company where we've been developing a platform that provides pharmacists and clinicians with that insight that they can act upon and then engage with that patient. An important message when you're engaging with, especially more complex patients, is making sure that message is simple, right? So how are we talking about one or two things that you need to do instead of 10? April and I were talking yesterday just about the simplicity in messaging and how that can ultimately drive behavior change, right? So if I give you a recommendation or two, you're much more likely to implement one of those things versus me giving you 10 different recommendations and you just kind of shut down and you're like, it's information overload. I can't handle all of that, and I'm not really sure what to do with this. So as those pharmacists are meeting with those individual patients that are coming into their to their store, or maybe they work for a health plan, how do you serve up the most critical information so that pharmacists can have the most meaningful impact in that very short window that you have with that individual? And there's a lot of work to be done there, to make sure that people are armed with the right information so that they can capitalize on that moment with that patient and really deliver a message that ultimately is going to deliver better care.
That's great. We've talked about the role a pharmacy plays, its importance, how that role is expanding, but what hinders growth? What barriers does pharmacy face in value-based care models and greater adoption?
I'll jump in first if you don't mind, April, and then I'll turn it over to you. One of my observations over the many years that I've been with this company, and as we've been exploring different ways for pharmacy to impact medical spend, is that in our industry, there is generally not a large connection point between pharmacy and medical. There are pharmacy type interventions that are being performed that in a lot of cases drive star ratings or HEDIS scores that are kind of siloed, right? They're not necessarily connected to medical outcomes. And so as we look at value-based care and going at risk, we're still at the very early stages of connecting those dots in my mind. There's a lot of work that still needs to be done in order for people to have a full appreciation for the fact that a pharmacy intervention or making sure that somebody is on all of those right medications can impact their medical cost. And as we're thinking about what that means, we're not all the way there yet. There's a lot of different models where health plans, PBMs, and others are putting pharma at risk for outcomes, right? So that's like a step in the right direction where somebody's been put on this specialty medication, and if you're not receiving the right outcomes, then there's penalties or reimbursement is adjusted. But as we're talking about how does a pharmacist impact your total medical spend, there's not a lot of those models out there today. And so we're trying to change that. But I think it's important that people start to see that connection.
Yeah, and I think to just add to that, there's two other components, one of which, Brian, you spoke to earlier, which is really the misalignment of how the industry has developed reimbursement models, how it views the pharmacist as, not really recognized as a provider of care, and they are in fact a clinician. And so that really needs to be rectified. And I think we're at a critical moment, again, because of some of the other things that we talked about, that we're really going to be forced to change how we think about it. It wasn't always like this, right? If you look at the history of the evolution of pharmacy and the pharmacist was very trusted as a clinician and someone who could provide care as part of a care team. And that has evolved in the other direction over the last 50, 60 years. And so I think we have to get back to that understanding and have a structure that really supports putting the patient at the center, as opposed to, what I would call today very transactional business that is about filling the prescription. And that's not what this is about. It's really about helping a patient either manage a condition or overcome something that's acute. The second thing is the advancement of science and technology and the pace with which the healthcare industry accepts and utilizes that information for the betterment of patient care it's just very slow. So when I think about things like genomics and pharmacogenomics and the idea of precision medicine, which has historically been something that, we as an industry have thought about as very expensive, not something that you can make available to everyone, it's become a lot less expensive to do those types of tests. And if you consider the cost of, a $300 genomics test against the cost of a cancer treatment drug that will have no effect because you do not actually have the metabolic pathway to allow you to have the benefit of that drug, it starts to not really make sense, right? So really getting to a place where we're accepting that the science is real, the advancement in technology is beneficial, and establishing, better ways, more cost-effective ways to utilize that in order to optimize care, I think is the other big challenge.
I like your last example, April, and the point about no impact, but also equally important, right, is lost time for the patient, right, with a therapy that is not working. So great. Well, we're at our last question of the day. What role will TRHC play in helping the industry move forward?
So I'm happy to start. April, jump in. I think we share a common viewpoint on how we're thinking about our role here at Tabula Rasa, but we've spent a long time developing an expertise for managing medication risk and other risk for really complex patients in our healthcare system. And some of that is through the proprietary technology that we've been developing here that gives us those insights that I was referring to before that nobody else in the industry has today. It's important and incumbent upon us as a company to bring that much more broadly to the market so that we can have the impact on patient care and medical costs that we've seen time and time again in multiple settings of care demonstrated for our customers and for the patients that they serve. And so I'm really energized around what we have been building and the impact that it can have. And right now we're in a really good position to advance bringing that into other markets. PACE is going to continue to be a really important market for us. And there's some other adjacent opportunities that we think are going to put us in a position where we can really expand the number of lives that we're touching. Not just the technology platform that we've been building, but our clinical teams that have a real expertise in engaging with these patients that are very complex and in need of some advice and counsel. And also the clinicians that are taking care of these individuals, and they need better information and tools. And I feel like we're in a very good position to bring those to some new markets and have a really significant impact. April, what would you say on that?
Yeah, I mean, I totally agree. I think the pharmacy and the pharmacist is a very natural extension and ally, and really a key component of a patient's coordinated care team. And I think that it cannot be overlooked. And so the work that we do here, I think as it stands alone, makes significant impact to things like, decreasing hospitalizations and readmissions, improving adherence to the right medication regimen, reducing fall risk. And I do believe we have a responsibility to bring this to everyone because it's life-saving and I think life-changing. But as importantly, it's just really needed. That clinical support is really needed right now. There is such a gap to fill. And I don't know how we get there if it's not through pharmacists and other clinicians. So I think we have a really key role to play.
Brian and April, thank you so much for joining me today on our first episode of Prescription Health. We really appreciate you taking the time to share your insights and knowledge with us.
Frank, thank you so much for having us. I think you could hear from the dialogue today that there's a tremendous opportunity that we all have in front of us for pharmacists to play a bigger role. And I think that we at Tabula Rasa have a mission to make that happen in terms of what we can do to simplify, individualize the care and improve the health of those that we serve. April, what about you? Any closing comments?
Yeah, I just, again, like to say thank you for having us. I think this has been a great opportunity to talk a little bit about how we see the healthcare landscape changing and where we think we have an opportunity to help. So appreciate the time.
Thank you for tuning in to our first episode of Prescription Health. Join us next time with host Dr. Ankur Patel, Chief Medical Officer of Tabula Rasa Healthcare, and a panel of industry experts to discuss participant enrollment in PACE. Prescription Health is brought to you by Tabula Rasa Healthcare, a leader in providing patient-specific, data-driven technology and solutions, with a mission to enable simplified and individualized care that improves the health of those served. For more information, please visit tabularasahealthcare.com.